Now, there are calls for more staff to be made available at public hospitals to ensure that patients are able to access mental health services. National government marked World Mental Health Day in northern KwaZulu-Natal today. Newzroom Afrika's Karinda Jagmohan reports.
Mental health issues are prevalent among South Africans who face a barrage of socio-economic problems. Some turn to drugs to numb the pain.
KwaZulu-Natal, like many other provinces, face a high prevalence of mental health issues. Mental disorders such as depression, anxiety, and post-traumatic stress disorder are quite prevalent, and conditions like schizophrenia and bipolar disorder affect many individuals and their families. Alcohol and drug abuse are some of the risk factors that directly lead to the development of a number of substance-induced mental disorders, which can trigger symptoms of anxiety, depression, psychosis, and other mental health conditions in a person. Even drugs, which some may consider harmless or fashionable, such as dagga, and others that are more harmful and highly addictive, such as cocaine, niwunga, intash, are all known to have devastating effects on a person's mental health.
The 2016 Life Esidimeni tragedy in Gauteng has exposed the state's apparent neglect. Over 100 mental health patients died after being transferred to unregistered facilities that weren't equipped to treat them.
In March 2019, the Commission released its report in which it made various findings and recommendations, and mainly to the Department of Health and to all the 9 provincial departments of health. Among those, it found that some of the human rights concerns and violations had happened because of the prolonged and systematic neglect of mental health at the level of policy and at the level of implementation. It also found that there was a serious lack of resourcing, lack of technical capacity, and even the lack of concern for the welfare of people with intellectual and psychological, social disabilities. The investigation also found that mental health care users were systematically excluded. The Commission found that there is a reason to suggest that the state's handling of mental health cannot be said to be reasonable in terms of the Constitutional Court standard setting, insofar as the progressive realization of economic and social rights is concerned.
The Health Minister says more healthcare professionals are needed in the public sector.
We are working very closely. We have made sure that all provinces have mental health boards, even at district level. We make sure that also at the national level, the Ministerial Advisory Committee on Mental Health is active, and we have a very interactive, cooperation at different levels to make sure that we don't drop the ball as far as the provision of services. We're still not up right there. I mean, part of the thing which we are struggling is to attract some of the professionals who are largely like psychiatrists. There are not many in the country, and the few who are there are largely in the private sector.
Meanwhile, the district mayor gave a personal account of his mother's struggle with dementia. He's urged those suffering to speak out.
It's to seek help and come to the hospitals and explain that your loved one has got the symptoms of forgetting and so forth, and just seek help. There is medication. Unfortunately, there's no cure at the moment, but there is medication, as well as to treat also the family members, because they also get affected. They get stressed and they want to leave their loved one, so they must also get counseling and get capacitated so that they can be able to help.
A toll-free helpline is available via the South African Depression and Anxiety Group. For Newzroom Africa on Channel 405, I'm Karinda Jagmohan in Newcastle.